to introduce myself, I'm Afshan Khan. I'm an adult and a child psychiatrist. I have a private practice in Westlake. I take a couple of insurances, and I'm more than happy to answer any questions. My email should be in my bio. It's my first name, last name, md@gmail.com. I'm at Austin Family Psychiatry. So you guys can find me if you have any questions and you want to send personal messages if you don't want to kind of get them answered right now. But the goal is to talk a little more about parenting an anxious child. And, parenting is an art. I really believe it's something that you kind of learn and practice, and some of it is acquired through how your parents parented you. So it's definitely a challenging thing to do, and more stumbling experience, I say. I made these slides. I'm not the best at it. So I have my own anxiety about presenting. So the slides are more like an help for me to be able to talk about these things and be able to guide me through my talks. I'm not going all over the place, but feel free to raise your hand, ask questions, put it on the chat box, and hopefully I'll see them while I'm kind of doing it, or we can kind of go back and talk about it at the end. So basically, we're going to talk a little bit about parenting an anxious child. I have an anxious child and I have some experience with it. So I'm going to bring in some of my own personal experiences with it. So really, I think part of understanding anxiety, the biggest goal would be really understanding anxiety. We all are anxious at some level, and fear is a complex reaction. Fear is what brings in this anxiety and a response to like something bad's going to happen. And I often say anxiety is a part of evolutionary psychiatry. We were all hunters as humans. We were out in the jungle, and getting anxious or being afraid was sort of a normal thing that kept you protected, saved you from things, saved you from your predators. So anxiety is part of being who you are. And how do you kind of figure out where do you draw a line between being good anxiety or bad anxiety? And that's my favorite term that I use with kids, is a good anxiety or bad anxiety, because then you kind of break it down rather than saying anxiety is all bad. So definitely there's a good anxiety part, right? We're talking about anxiety is good because it kind of keeps you protected, keeps you safe, and this is just part of who we are. Sometimes people take it to a whole different level, right? So there's so many different anxieties that we can talk about. And in terms of, I'm going to really focus on generalized anxiety disorder today, just so we do not go into health anxieties, which is a new thing with COVID. Kids have been afraid of going out because they're like, I'm going to be afraid because I want to wear a mask, don't want to wear a mask. I can't go out because Corona is out there. So there's also health anxiety. This panic disorder, when anxiety gets to a point where you're physically having symptoms, and you have physiological representation of chest pain, cardiac pain, hurting in the belly, all these, and it kind of comes into panic disorders. And then there's this OCD part too, where OCD is obsessive compulsive disorders, where kids actually get into the point that they have to do rituals to kind of get through their anxiety. So I'm not going to talk about all of those things, but sort of talk a little more about generalized anxiety disorder, which means you really have to have feeling anxiety, which is, you immediately get into negative conclusions. You have difficulty focusing. Your mind goes blank. You're having difficulty handling situations. You're stressed about things. Your inability to relax. You're persistently worrying or obsessing with things, and worrying excessive. I often call kids who have anxiety are just hypersensitive. They're just anxious, but they're more anxious than other people. And then in general, when you're talking about anxiety, we're really talking about how severe is anxiety. And when I say severe, it means people are not able to do things that they would usually do. It's so disproportionate that we all are afraid of things. But if it's beyond regular stuff, then the anxiety is disproportionate. You're also talking about anxiety about everything, from going out, going to school, meeting friends, talking to people, not wanting to be able to do anything. And it's about everything. And then you have no control with anxiety. You do understand you're anxious and your thoughts are wrong, but kids say, I just can't control it. I'm not able to do this. And then they start having physical symptoms of being really startled, complaining about fatigue, irritability, muscle tension. They're sweating, they're having tremors. They even have trouble sleeping. I get a lot of kids who also get to the point where they're really having tummy aches. I get a lot of people who have been to a neurologist several times, seen gastroenterologist several times before they made it to a psychiatrist, partly because anxiety is presented with cyclical vomitings, partly their anxiety is presented with constant tummy aches with the reasons not wanting to go to school. Teenagers will often present with headaches. They've been to the eye doctor, they've been to the neurologist, they've been tried on different medications, but they still are struggling with some of these things. So they come to us with those symptoms, and that's what I call generalized anxiety disorder. And obsessive compulsive disorder would be something where they really are so obsessed about certain things. They have to do it in a ritual pattern. They have to erase their homework certain time. They're trying to be very perfect about everything. They have to check the doors, check things, check their homework, what is about things. But we're going to really focus on generalized anxiety disorder today and talk about it. So we really have to understand anxiety, right? Anxiety is definitely where you're kind of feeling that you have no control. And as parents, and definitely there are all these treatment options and stuff, but I'm really going to focus on how do you help an anxious child. We're going to get into two modules. One is a treatment part, which is the treatment part is taking medications and therapy. I'm going to start off a little more reverse with talking about strategies while we talk about what it presents like and what can you do. And the biggest thing is when a kid says, I'm anxious, the first thing as a parent, you'd be like, oh, you can't be anxious about this, or you can't worry about this. And I think that is the biggest thing that we need to step away from, and really validating their feelings, talking about why are they feeling this way, and how do we hear them out, just listen to them and say, I hear you're anxious. I hear you're worried about the test. I hear you're worried about getting out and seeing your friends. And I think validating, and it must be hard. It is hard to kind of do this. It is difficult. If you're a 10-year-old saying, yes, you're a 10-year-old and you're worried about going to school. Yes, that's normal. Sort of just making it a little more easier for them to express their feelings. And then sort of working through how do you sort of go through distinguishing where is that, is this a real threat or false alarm? And really kind of having a kid build these skills, right? That's the whole goal of managing that anxiety, is how do we get our child to say, you're being chased by a lion versus something bad's going to happen. Really identifying and giving levels to anxiety. I often say to people that anxiety is like a video game to kids, because it's outside of you. Because if you make it outside of you, it's easier to fight. Rather, it is within you. Most kids think I'm anxious and this is me and this is who I am. But really teaching the kids to say anxiety is outside of you. It's like a video game you're playing. Who wins? You win or the anxiety wins? So really finding out how do you do that? And then once they kind of feel that, okay, this is not me, this is from outside, then they find it easier. The second step is really kind of identifying it from, is this a real threat or a false alarm? So yes, if you're afraid because something bad's going to happen, say it's a bad weather day and yeah, something bad's going to happen, you really kind of say, or is it that it's raining outside and you're afraid? So really challenging that out and making it differentiated for them. Then tackling the negative thoughts. We'll talk a little more about that in a little more depth, and talk about deep breathing too. It's so easy to say to kids, take a deep breath, calm down. It's so hard for them to do. I get a lot of teenagers says, breathing techniques do not work for me. And with the little ones, I often try to tell them is, how about you feel like you can smell a pizza? So how do you feel like if you want to smell a pizza? And creating situations where you say that they really would engage, rather than just saying, take some deep breaths. So a good example for a 10-year-old would be, how about you smell a hot pizza and how does that feel like? And then sort of saying, can you take that smell and feel it? Pretend you can smell it, and then sort of pretend that you're blowing on a hot pizza. So sort of giving them techniques to work through is also a good way. The other thing that we talk about is step ladder approach. You can kind of say, kid, if you can't sleep in your room because you're afraid, go back to your room and sleep. We really have to have more of a step ladder approach, regardless of everything. Even if it's social anxiety, you can't say, you can't be afraid, go talk to that kid. Or you can't be afraid. So really a step ladder approach where I'm going to just take the not sleeping in your room. I'm afraid because they're monsters. You kind of let them sleep in your room on the mattress in your floor. Then you let that mattress move in a few days to their room. Then you promise them you will stay with them in the room. Then you reassure them that you're going to check on them few times and really kind of staying on it, and then really letting them sleep in their room. Any of these things, it has to be an open discussion. We see our kids anxious, we get anxious, and we're like, okay, this is how we're going to do it. But really saying that every little success and every little step, reassuring them, walking through over days and weeks is better way. The other thing is help them change the channel, right? So if your kid's saying, I've got a science test and I'm really afraid tomorrow, um, the best thing would be to really say, that's okay. It's allowed to be afraid about a test. You're allowed to kind of worry about things, but how do you what can you do now to not focus on that? Maybe do some tests, maybe even change and go play outside for a while and see if that'll help. Um, the most common things parents usually do is forget about it, don't worry, you will do fine. Those kind of things never help a kid, and really kind of changing that talk with them. Again, we can go into parenting styles. Um, Parents who have high expectations from their child want the kid to be successful, who put a lot of pressure on perfectionism. We know that's not a good thing. But we also know that you can't let the kid be completely do it yourself, because that plays an own challenge of saying, hey, if I'm going to let my kid, the kids who are anxious would like some discipline. Discipline actually is good. And often I think when people sort of say, oh, I'm not been putting pressure on my child because I don't want them to kind of be anxious about things, we're actually doing the opposite too. They do need structure. Discipline helps the kid kind of feel less anxious. So we don't need restrictive, we don't need too much of permissive parenting. We need something in between where you let the child find the way, but know that you're there at every step. And this is what I tell kids is, childhood is really a training battlefield where you're really learning how to kind of make mistakes, and you have your parents to help you work through it. So you know how to kind of get through things. Yeah, and so kind of moving into parenting anxious child, the goal isn't to eliminate the anxiety, it's just to help them manage it. And I think as a parent myself, seeing a child suffer or go through that pain, you as a parent want to jump in and want to correct them and want to take care of their anxiety, and you want to eliminate the anxiety. And I think that's not the goal. You cannot eliminate the anxiety. You really need the child to work through it. And I often say, it's okay to be anxious. You just have to identify good and bad anxiety. Then you're going to be, if you get anxious now as a child, the chances are you are built in a way that you're more hypersensitive to things, and you probably will be anxious as an adult. And my goal is not to take away your anxiety. My goal is to teach you how to kind of manage it and make it something that you can learn to get over it, or be able to manage it if it comes through. And I say anxiety is good for some people. It makes you sort of a type A person. You check on things and you're more aware of the things. But when do you kind of change that bad anxiety to good anxiety? Is when you first identify it and not make it part of you, and then work through it, rather than saying, I'm going to get over this anxiety and avoid this panic attack, or I'm going to start getting better. Because a lot of kids, as they start getting better, they are afraid to have those panic attacks, are afraid to be socially anxious. They're like, if I don't keep doing certain things, then I'm not going to be successful. And I think we really need to change that narrative for them. um, and the other thing, I get a lot of school refusals with anxiety. Parents are like, oh, my child is anxious to go to school, so I've stopped taking them to school. Or can you write me a letter that like my kid can't go to school for 4 weeks? It doesn't work that way. When the kid is anxious about some things, you can't just avoid things, but you kind of have to work in the same step ladder approach of um, doing things. Again, you got to express positivity, be realistic with expectations. If it's a bad weather and your kid's worried that the sky's going to fall apart, you can't just say that's not going to happen. You sort of say, okay, rain's good. It helps, and bringing in that positivity about weather. And then saying, yeah, sometimes things can bad, realistically, things can happen, which may not be right. And how do you work through that? And respecting their feelings. Often it is so hard as a parent, again, to watch your kids suffer, and you want to shut it off somehow because you're trying to jump into wanting to save them, but really kind of respecting the feelings and not making fun of it, not sort of telling them, hey, this is not, you're not, those feelings are not abnormal, or sort of saying you're worrying about things too much, you don't have to worry about it, or that's okay, it's just a test, you can't worry about it, or that's just going to party, what are you worried about talking to people? um, we all make these mistakes, and really kind of respecting their feelings about it, um, but at the same time also correcting that maybe this is not all that right. um, and then I think we tend to ask leading questions. We jump in and ask them about, why do you think you're afraid? What do you think is going to happen? Again, we tend to do those things, and then we're really working on saying if, and then, the worst thing is when a kid says, I'm stupid. Um, Parents have to jump and say, honey, you're not stupid. Why are you saying these kind of things? Instead of saying, okay, this is what you think, then what would you tell a friend who feels they're stupid, rather than kind of making them more third person? So they think, how can you be kind to somebody who says that they're stupid? What would you say to a friend who said this to you? And having them come up with answers, because those will be the answers in their brain. And do not reinforce child's fears. We all know that we kind of jump into, if they're afraid, we're trying to avoid it. Take away things they're afraid of, toys that they don't want to play with, or they don't want to sleep in their room. We kind of, we're not consistent enough to practice a step-ladder approach. And then encouraging them to tolerate the anxiety. It's okay to be anxious. And again, going back to the good and bad anxiety and saying, it's okay to be anxious. You have good anxiety, and some of it is maybe bad. And there's nothing wrong with being anxious. And when they kind of accept that, it takes away the pain, it takes away the feeling of illness, it takes away the feeling of failing, you're letting them fail in any way. And saying, okay, we got to keep that anticipated, like, okay, we're going to get anxious about a test tomorrow. If you keep discussing it more and more and more, the anticipatory period gets longer. So sometimes really kind of acknowledging it and changing the topic. There's a most common thing with anxiety and fears when kids talk about it. I often say it's 1/3 of really accepting how much of acknowledging it. 1/3 is really kind of listening to it and not answering. 1/3 is changing the topic. So when a kid repeats about whatever the anxieties, you do the 1/3 rule. That way you keep the anticipatory period short. And then sometimes thinking things through with a child. We sit down and we let them come up with what the anxieties. And venting is what we call, is when they're venting about this process. They're talking about how do they really go through these things, and they're what would it happen, and they'll have answers for everything. Their anxiety is kind of made up a whole of a story, and we let them kind of talk about the story, and then we poke holes in their story, right? We let them ask, what I wonder why you kind of think this, and that kind of starts off for them to feel like, yeah, my story doesn't make sense. Why am I saying this story to myself? And then we can talk about, try to model healthy ways of handling anxiety as parents. I call anxiety the cough of medicine. If you're going to cough, your child is going to cough. And you go to a doctor and say, oh, I gave my child a cough. But anxiety is exactly the same way. If you're coughing, your child is coughing. If you're anxious, your child is anxious. Except as adults, we have different ways of dealing with anxiety. We have different ways of expressing our anxiety. But kids are like sponges. They take in and they have their own way of presenting. And as adults, we've built our own coping skills. My best example for myself is I get in the car and I'm yelling at my kids to get in the car, we're getting late and things like that. And my kids have to remind, we're not going to school, we're going to HEB. So I have to check in with myself so often that how am I being anxious and how do I transfer this anxiety to my kids? Because I could be handling it, but kids may be handling it in a different way. Most parents, right? How your anxiety may affect your parenting. Sometimes parents get into this point where they're like, they do everything for their child. They know the child's going to get anxious. So they're going to prepare things for them. They're going to worry about the weather and take the kid in another room. They're going to not take the kid because the kid is socially anxious. Because the kid's worried about health anxieties, they will go to every doctor to make sure they get answers and get the kid answered with all those things. So really taking a step back and realizing, are you doing everything for yourself so you protect your child's anxiety? That's one thing where kids, and they start getting to micromanage the activities. If kids are having struggles failing, organizing themselves, parents get in, micromanage the homework, micromanage things, micromanage their grades, micromanage everything for the child. That's not going to be helpful. And like I said, we transfer anxiety. You won't let your child do age appropriate activities. So you can't go to bed, or you can't do this, or you can't do this, because then the kid starts building up his own anxiety. You can't play this toy, you can't go out there, because you start feeling like this is not right, my child's going to fall. If you're going to be afraid that my child is going to fall, the child will really be afraid of falling himself or herself. So really kind of watching for those things. And then you maintain hard and fast rules. There's a lot of cognitive flexibility that prevents anxiety. And when I say cognitive flexibility is where people sort of say, okay, here I am. This is exactly what you get. This is exactly what you're supposed to do. This is exactly where you're supposed to sleep. This is exactly. And that kind of hard and fast rules, and really checking on ourselves. Am I doing everything for my kid? Am I organizing my kid? Am I not letting my child fail because I am anxious? And how is my anxiety affecting my child? And how you don't let them play the playground because you're afraid they'll fall. And the child definitely is always going to be afraid of falling and making mistakes. And really checking into that with parenting. Getting to treatment, right? Their medications, and that is what I majorly do. And but I really wanted to kind of talk a little bit about this as a treatment part. People who come to me, I often say I'm pretty conservative with treatment managements, and I tend to tell people that, hey, I'm happy to kind of do medications, but I'm also going to tell you things about medication only if they need it. And most often, if people are not ready for medication, we've got a holistic approach of doing some micronutrient supplementations, which is chelated multivitamins that we put together. And then the antihistaminics. I bring up antihistaminics because that's a good way of treating. Antihistaminics are like your Benadryl and his Western, and people don't understand how we often kind of get into antihistaminics because hydroxyzine or Western is basically Benadryl. It does not treat the anxiety, but it brings it down by a couple of notches. So I often say that could be an as needed way of treating anxiety. So people who take antihistaminics, I suppose they're going to school, taking a test, sometimes it brings it down a notch so they're able to do things better and able to engage better. SSRIs or SNRIs are antidepressants. Antidepressants work for anxiety. So if a doctor is prescribing an antidepressant, do not be shocked because they are anti-anxiety medications too. And there's a whole list of things that kind of go through. Zoloft, Prozac, Lexapro are the most common used in kids, and they've been well studied over years. And most common side effects are really nausea, GI symptoms, headaches, irritability, but that all goes away. So really mild symptoms studied over years and helpful, except they take 4 to 6 weeks before they show some action. Plus, it comes with a black box warning of increased suicidal ideation. So you get to hear a lot of parents say, oh, my kid might have suicidal thoughts. Honestly, it's pretty controversial. They did a research out of 1,000 people, 14 people scratched themselves. So they had to put it on the box. Regardless, I've done this for years, 15 years or more, and really found people finding it very beneficial of working through that. So I would highly, highly recommend if you feel like medication has been suggested or you think you're at the point that medication is an answer, please try to understand it and give it to your kids. And if not, ask questions. But that's really, I often see people stay on medication at least 3 to 4 weeks and then extend it out to 2 years if there's constant relapse or prevention. But they're known to get things better, and it takes 4 to 6 weeks for the medication to act. But again, therapy is another big source of way of kind of working through some of these things. There are different kind of therapy modalities, and it can get quite confusing when you're out there to know what it is. Talk therapy is one of the good therapies where you're really having a support, having a third person negotiator, really vent your stories, challenge your negative thoughts, and work through it. But cognitive behavioral therapy is specifically known to treat anxieties. What it really means is you have these automatic negative thoughts and you're challenging them. And we'll talk a little more about that. Exposure response prevention is another good therapy. Your kid is afraid of a certain thing, has phobias about it. They work through exposing the child, having response and prevention of that anxiety. And when your kid is less than 10 and really can engage in all of these automatic negative therapies, play therapy is one of the options to kind of work through some of those things. So talking about CBT, right? Cognitive behavioral therapy, it's type of a therapy where you identify the negative thought and you practice new skills and then you goal set and you problem solve. So the easiest example I often give to people, especially because anxiety is part of eating disorders too. An eating disorder is an anxious disorder. And this is a good example I talk about is I have eating disorder kids who come in and they look at a piece of cake and they're like, I'm not going to eat this piece of cake, I'm going to gain 10 pounds. And somewhere between, and they believe in it. And somewhere between, I say, is between looking at the cake and believing that it causes 10 pounds. We've had hundreds of thoughts that are automated and has got you to the point that a piece of cake is 10 pounds. And we build this. So I say there's such automatic negative thoughts that are happening. CBT, cognitive behavioral therapy, is challenging that automatic negative thoughts. There's a really good book for workbook called Mind Over Mood. I can send it to you all the names if you have questions, but Mind Over Mood is a good book, which is like a workbook, which really challenges how did I get from looking at a piece of cake to getting to 10 pounds and how do you work through it? So what cognitive behavioral therapy does in simple terms is really you sit down with the therapist, you start working on, wait a minute, how did you get there? And you're like, oh, I didn't even think about it. How did I get there? And then you identify the negative thought, you connect that thing, and then you start practicing new skills. Having more goal settings about how can I not get to that? Maybe I'll get to 5 pounds, maybe I get to 2 pounds of weight gain, and then kind of talk about those. So really kind of stepwise progress on how do you goal set and identify a problem, and then kind of go through list of possible solutions, finding strengths and weaknesses of each possible solution, choosing a solution to implement and implementing the solution. We'll talk a little more about all of those things as we go by. But self-monitoring is a big part of cognitive behavioral therapy. You monitor how you're going through some of these things. Daily workbooks. Did I kind of, there's so many negative thoughts we get into. I'm driving and I'm like, I'm going to get in an accident. And then you really have to challenge about how often are you, what's the rate of accidents on the road? What's traffic like? Why did I think from here to there? And really kind of self-monitoring and sometimes tracking and writing things down. The biggest failure rates for CBT is usually because change is difficult. We've kind of built in this negative thoughts, which are patterns that has been set in, and changing that can be difficult. CBT is very structured. It does not let you kind of open up to other things. So if you have anxiety which is generalized and has been caused by a lot of things, sometimes it can be difficult. And sometimes people are not willing to change. They're afraid that if they change, they'll lose themselves. They're afraid that sometimes anxiety keeps them going in this zoo they are. They're afraid that if they're not anxious, they're not going to be successful. So we tell ourselves these false narratives, and then it finds it harder to change those. And again, CBT takes time. All of this takes work, and it's very gradual, and that's why people are often not willing to work through it. And so just talking about how CBT works, we're going to talk a little more about some of the examples of negative cognitive distortions, right? Are irrational and exaggerated thought patterns where you're really coming into these negative thoughts. It's all or none thinking, where you're like, okay, I got a B and I might have as well got an F. Well, I went to school and a kid did not talk to me. That means everybody else is not going to talk to me. I'm bad. And so kids get into this all or none thinking, and there's no gray zone between, okay, if this kid did not talk to other kids, talk to me, and it's okay to kind of go to school. And then magnification. If the teacher sort of said something, it'd be like, oh, the teacher does not like me, or exaggerated versions of if the teacher just corrected and said, sit down in your chair, it'd be like, oh, the teacher yelled at me, screamed at me, was mad at me, and everybody was watching. So there's a whole magnification, and you really have to sit down with them and work through. And understanding these cognitive distortions are so important, because then if you understand them, then you're able to work through and see that in your child. When your child mentions a sentence and you're like, I see how you're doing catastrophic thinking there, how you're really magnifying things. But instead of just saying you're magnifying things, you're like, Is that right? Can we work through? Do you really think, what was her tone when she was yelling? Was she really mad, like 10 on 10, or was it? And really kind of helping them walk through this and then talking to them. And there's a lot of mind reading, right? If I go to the store, everybody's looking at me. And then that's really mind reading, because if you know what other people are thinking or they're looking at you, then you really have special powers of mind reading, and kind of, because then you challenge them from working through this. So understanding what negative thinking patterns they're having is so important. Overgeneralization. Like we said, I did this and this is going to happen again and again. Or this is going to happen this year. This, if I fail this, I'm going to fail everything in life. If I do not do well in 7th grade, that means whole my middle school is gone. And I can never be who I am. So really kind of letting them talk and finding those overgeneralization statements or mind reading statements or catastrophic thinking is important. And this is why we want to know how to combat this negative thinking, because if we identify these negative thoughts, then we're talking about how to cognitively restructure. And so identifying, becoming aware of those negative thoughts and determining the accuracy of your negative thoughts. People, if a kid says the whole class does not like me, and I would pick 5 kids and say, are you sure? Oh, have you asked so and so, so and so, so and so, Emma, Mary, John, and said, do you think that? And then it's like, okay, now you just said the whole class, but now you said 5 other kids are your good friends. So that really brings it down to 15 people in the class, and kind of challenging them and actively disputing those negative thoughts with them, not just saying that this is wrong, the whole class likes you, I don't know why you're talking about it, rather sort of letting them break it down and work through them. And then replacing those negative thoughts with more helpful ones by saying, oh, sounds like you have all of these other kids who really like you and want to be with you, and kind of bringing that positivity about the negative thoughts or the environment or situation. If a kid's worried about weather, I often say, what about what the rain does for the earth? What about the trees? What would they say if they had a choice about asking about how you're afraid of rain or bad weather? And really kind of working through some of those cognitive restructuring things and stuff. Those are the top things that CBT does. And obsessive compulsive disorder is another thing that we talk about and work through, and ask people how to kind of challenge some of these things. We go back to, I'm going to talk about some panic disorders. Panic disorders are really when kids are shaking, tremors, not able to think, yelling, screaming, lying on the floor, crying. And when people have a panic disorder, I often say, let them have that moment for a few minutes, because that is their space. Trying to kind of get them out of that is not going to help. And really sitting down with them and holding them, helping them kind of, there are quite a few grounding techniques people talk about. If they're really shaky, tremors, holding eyes, feeling something different, touching, letting them breathe somewhat might be a way. Some kids talk about feeling like their chest is closing and they're having a heart attack, or feeling chest pain, and trying to tell them this is not a heart attack, this is not going to help. But really kind of sitting with them and working through that. And then I often say it's easier to treat panic attacks when they're here versus when they get to the point that it gets harder. So really jumping into treat. If your kid's having a panic disorder, I would certainly talk about anxiety and kind of getting worse and getting there early on, rather than waiting for it to get even worse. So working through that is an important. Obsessive compulsive disorder is another big problem, where kids get really ritualistic. They have to do things in a certain way, count numbers in a certain way, get up and walk a certain way. That's because the anxiety is so bad that they really are coming up with ways to deal with it by trying to create rituals. And soon it gets to the point that they also get paranoid that if they didn't do things in a certain way, it would really get out of hand. So that's another thing for them to work on, is really, if your kid's at an OCD point, definitely needs medication and kind of working through therapy. And a good therapist will help through things. I know there is a shortage of therapists right now in Austin, and trying to find one is definitely harder, but finding a good cognitive behavioral therapist can help them work through some of these things really well. This is all I have for today. I just wanted to see if you guys have any questions, wanted to ask anything so we can kind of work through it. Do you guys have any questions? Anything that you want to have me say or ask? Taskina, I just unmuted you.
Yes, assalamu alaikum. That was a wonderful presentation. Can you hear me? Can you hear me? Can you hear me?
Taskina?
Yes, can you hear me?
We can't hear you actually.
You can hear me?
Did you want to type the question instead maybe?
Yes.
Oh, sorry. Okay. For some reason, I can't hear it. Let me move you into the panelists and see if. Taskina?
Yes, can you hear me? Hello?
Oh, there you go. I can hear you now. Sorry.
Okay. Assalamu alaikum. Jazakallah khair. Your presentation was wonderful. I wish a lot of my parents can actually would benefit from what you had presented. A lot of kids we're seeing nowadays with the COVID and all that, and they're staying in their room most of the time, and they're so anxious. So my question is regarding how to help kids, especially teens, who go through their anxiety. They're going through their anxiety, and there's a fine line between anxiety and panic attack. And they just, from one point, it's like, oh my gosh, it's uncontrollable. What can we do to allay that panic feeling from one moment of being, okay, I'm anxious, and then sudden doom? Like, how do parents help them calm down?
You know, that is a great question. And I've been talking about what my practice has gone in COVID. It has gotten intense. I do child psychiatry, and it has exploded in a lot of ways. Initially, it was those kids who were really extroverts who went out and did things, did not like being logged in and being at home. And then the ones who were really introverted and liked staying home actually enjoyed it initially. But now I'm also seeing anxiety in kids who've been logged in and really sort of feeling like they can't keep up with things at school and stuff. So my answer is going to be a little long-winded because I'm going to start off talking about a lot about sleep and appetite, really prevention techniques. And so with prevention techniques, it's sleep. I can't tell you how much sleep is important. I wish I could sell all of these kids sleep in a packet in some way, because that's where all your chemicals are regenerating. And working on good sleep patterns is like, I'm sleeping fine. I'm doing homework till 1 a.m. I'm getting in the morning and I'm not sleeping enough, but I'm talking about how well I'm sleeping. So 7 to 8 hours of good sleep. And it's almost like if you sleep well, and when I say sleep well, it's not sleep well for a week, it's at least 21 to 16 to 21 days, they say, that it's almost like an automated switch between your anxiety and panic disorders, that it works. Your chemicals are better regenerated and you're doing better. So definitely, that's another part. Eating, right? Healthy eating is another bit. Processed foods, a lot of chemicals in our thing. We're not getting our multivitamins and minerals. And how do we add all of those? Vitamin D levels, all of these kids during COVID. And there's a huge correlation between low vitamin D levels and depression, anxiety. And we're seeing a lot of those things too. So kind of working on eating healthy, sleeping better to kind of prevent anxiety and panic. So what you're talking about is generalized anxiety disorder and somebody who really kind of having a moment where they just can't take it anymore. I often say is sort of working on one day at a time. And correct me if I'm not getting to answer your question, right? But if you feel like this anticipatory anxiety, I was doing fine, I was anxious about the test, but just before that, I'm at this verge of, I feel like I can't focus, my brain's foggy, I'm shaking, and I can't do things. Letting them kind of just sit with that moment. Accepting the panic disorder is one thing I say. Second thing, really kind of giving this biggest thing about CBT's insight. We talk about how somebody can be at a point where the whole video game example is, I have anxiety, but it's a monster outside of me. Who's going to win, me or the monster? And I often say panic disorder or anxiety or something lasts few seconds to few minutes, and then you're over it. And that's where sometimes I often get to people with hydroxyzine, which is like Benadryl. Taking that, 1/3 of people find it really relieving from having an anticipatory anxiety, like your generalized anxiety. And then you kind of get to a point where your panic gets out of control. Then this sort of medications help you kind of not get to that point from generalized to panic disorder. Sometimes kids find it like they have to fall asleep. And then when they wake up, they're not anxious so much, or they don't get to the panic level. And sometimes kids find it sedating, so they sleep and they feel better. So really letting that panic disorder happen, but also working on the next few upcoming days on what happened there, a little bit of debriefing in terms of how did I get to panic? I was anxious, but how did I get to panic, and working through that is a good way to work on. Did that answer your question, Tiskina?
Yes, thank you so much. That's communication is always the key, so that's important. Thank you so much.
Definitely. And then consistency, right? Because we want to do this one day, you're like this whole good parent who's like, okay, I'm going to be supportive. And next day you're like, I can't be hearing about your anxiety all the time, every time. So definitely. And then there's another question here. I said, high school student soon to be 18 who's refusing to go to college, wanting to take care of maybe, but he will do some community, even if he's smart, and what wanted to go and leave, who wanted to go and leave on his. So if we're getting a lot of this, right? Because some of the kids are, last year was even more harder when everything was online, virtual. Kids are like, why am I paying so much of college fees to go away to college if I'm going to sit at home and do things? That, with the lack of motivation, is a huge problem in high schoolers, middle schoolers, everybody who kind of stayed home having to restart. And I've been encouraging everybody to go back to school, even if it means last 2 weeks of end of the year, so we can do things. Really, I'm a big believer of to-do list, and there's a lot of research on to-do list and creating structure and working through things. So if your kid's refusing to go to college and they're capable, I've been telling everybody, make your summer structured. And how do you make a list? Okay, you don't want to go to college. Let's start off making what your next week is going to look like. Write it down. And visual imagery is such a big thing, right? So because if they don't write it down, if they don't plan and then don't click, and as they kind of create that list, it'll help them sort of see that I got to do this. Okay, you don't want to go to college, that's fine. What are you next week you're going to do? If you're going to work, what time to what time? Like detail writing it down and having them check off that list is a good part. And I've been encouraging people, like kids do not like therapy. They don't like the idea of being sick enough or ill to go to a therapist. So I sell the idea of life coaching. I often say to people that go to family therapy, go to individual therapy, mention some cool celebrities who do life coaching and kind of encourage them, and they feel like, okay, it's not about you having anxiety, but it's helping you plan your life. And I often say these are skills. They're going to create a toolbox for you, the toolbox that you can use if you have a roommate at college, you're at work and you're a team manager, or you have people in your office that you have to deal with. How do you deal with, and how do you teach them deal with things? And how do you deal with stress? And so what about having a life coach who can help you kind of work through some of those things? And a lot of people who've not been wanting to go to college, I'm always afraid that they'll get into these patterns of not wanting to do things, because even though they may not acknowledge it, anxiety may be a part of being afraid. And how do you kind of help them work through some of those things? So definitely a therapist, I think, would help them work through some of those things. Did I answer your question? Okay. Thanks. So is there anything else? I've really been encouraging people to get a therapist or a life coach, because I think we need to, the biggest struggle for me when I see kids who are anxious is if you don't start treating them early on and give them tools, it starts getting out of hand. And giving them tools, calling it tools that they can use when they're older and adult. is a good way to sell that and for us to do the work. Mind Over Mood is a really $15, I want to say, on Amazon. It's a really good book. I'm going to put it here. And Brené Brown is an awesome author. I wish she made a lot more kid series things, but she really talks about perfectionism in kids or adults and how embarrassment and shame is a big thing and how to accept that embarrassment and shame. She's written Gifts of Imperfection, Brave Enough, a couple of nice books, which really talks about what if you made a mistake and how do you take that? Because people who are anxious often are afraid of making mistakes, and really accepting the mistakes and having fun with that mistakes is such a big part for our kids to learn. So I am available on, let me type my email address too. And I have my website on Austin Family Psychiatry. And if you guys have any questions, please feel free to reach out to me. And then I'm happy to redirect you all, help you all work through some of those things. Thank you. I'm going to stop this recording and